Welcome to IDLM Presents Honest Conversations on End of Life. Here we open the door to compassionate, open dialogue about life's final journey. Join us as we explore insights from professional caregivers and doulas and those directly touched by end of life experiences. Together, we aim to demystify, inform, and support each other throughout stories, knowledge, and the understanding that every conversation brings us closer to honoring life in all its stages. This November, in honor of National Hospice Month, we are thrilled to shine spotlight on our partner, Karen and Quinlan Hospice. Today, we are joined by Lee Ellison, Director of Marketing and the Director of Karen and Quinlan Care Concepts End of Life Doula Navigator Program, to dive deeper into their palliative care approach. Welcome back. Thank you so much for joining us today. Today we are excited to welcome back Lee Ellison with Karen and Quinlan Care Concepts. And we're so excited to have you back, Lee. And today we're going to be talking about y'all's palliative program.
Thank you. Thanks for having me back.
I'm so excited. And can you share a little bit, Lee, about y'all's palliative program and how did that all kind of take place and when did it start?
Sure. Well, Quinlan Palliative Care is one of the divisions of Quinlan Care Concepts. And our mission of the palliative care is to provide a holistic, compassionate medical care and support, to patients living with a serious illness in the setting of their choice. Our palliative care strategy is a win-win-win. It improves our patients' quality of care while contributing to our organization's mission of caring for the seriously ill by basically doing the right thing, providing care that is aligned with the patient's goals and values. And thirdly, our palliative care improves the efficiency and offers support to primary care providers and specialists in caring for some of their most complex patients. What inspired the development with our organization is studies show that at least 12 million adults and 400,000 children in the United States are living with a serious illness, including metastatic cancer, advanced dementia, heart failure, congenital illnesses, and this number is expected to grow significantly over the next 2 decades. So we developed a separate division, the Palliative Care Program, to help people in our community who are seriously ill but not eligible for or do not elect to be on hospice services. And I'm going to say we started palliative care our program probably just before COVID came about. So what was that, 2020? So we've been growing steadily, since the launch of the program. And, our goal is, to identify and support patients before they end up back in the hospital in that endless cycle of crisis care, to identify patients who are utilizing crisis care, going to the emergency room, unsure what their plan is, unsure of how to cope with the anxiety or the stress of having a serious illness, or who are recently diagnosed and don't know what to do next. They came home from the doctor's office with a diagnosis and they just don't know what the next step is. So our program is a medical care focused on the relief of symptoms and stress of a serious illness. And it's based on need, not prognosis. And the goal is to improve the quality of life for the patient and the family.
So when someone comes on to palliative services, they will typically come maybe even for like pain management. They're getting unrelieved pain control. So the doctors will refer out to y'all to palliative programming, and then y'all would go in. And what type of team, what type of support is it? Do they have just nurses that come in and coordinate with the doctors, or what does that look like?
Well, we have an interdisciplinary team, for the palliative care program too. Like we have a medical director for the overall care plan oversight. We have a nurse practitioner who does home visits which helps families so they don't have to get dressed, leave the home, travel, sit in the doctor's office, etc. So it saves time and energy for the patient and the physicians. Our nurse practitioners focus on symptom management, a physical assessment, goals of care discussions, coordinating care with the patient's primary care providers and specialists. And then we would have like a social worker who would be available to put the family in touch with community resources. And if the care plan calls for a volunteer, one can be available to give the primary caretaker a break, so they can care for themselves.
That's
And we can
amazing.
also offer, the services of one of our end-of-life doula navigators to help understand the goals and the priorities that the family has. So it's really an interdisciplinary team, not as many members as hospice, but, a good core of people to help the family.
And it sounds like too, with coming together with that interdisciplinary team that is all coming together, we're still covering and especially too, and having your navigators a part of that, they're able to hit the physical, emotional, and the spiritual needs of the family and the patient as well as they're going through this time frame.
Right.
And I have to ask, like, so what does a time frame sometimes look like? Is it something that they can stay on long term, or how does that work?
Yes, and a good question. I mean, we meet the patients where they are in the trajectory of their disease or prognosis, diagnosis. So a a patient can stay on it as long as they need the care, not like hospice where you have to get recertified every 6 months to, ensure because of Medicare, Medicaid, or, that you qualify for hospice with that 6 months or less diagnosis. With palliative care, we're there every step of the way for the patient. You know, whether they get better and no longer need a palliative care, they can elect to not have those services. Or if they transition, and the disease progresses and they need to transition to more care, then we're there to help guide them, in that process, maybe, to hospice care. So there's no length of stay that we say, okay, that's it, you're off the program. We're there for them as long as they need us.
That's beautiful because a
Mhm.
lot of families too, they just need that extra support. And honestly, I too, it just makes me think about this is that I think that in the coming years, year, 2 years, 3 years, their families are going to need so much support, right?
Mhm.
They're going to need that extra layer of support so they can gain that information too from the navigators and then programs such as the palliative program to help support those families as they're
Right.
navigating this difficult journey of things going on. So, Lee, is there any special Pacific workshops or events or any type of resources or education, maybe things that y'all might be doing in the community that you could share with our listeners, and so that maybe they can try to catch those throughout the year?
Sure. And throughout the year, we always have special workshops and seminars at local libraries and, different facilities. This month during National Hospice and Palliative Care Month, we really were making the most of the promotion and around that. And we have been holding um, hospice versus palliative care. What's the difference and, what is best for your family? So the best way to know what we have coming up is we have a Quinlan Palliative Care Facebook page and our website at quinlanpalliativecare.org. So you can get more information about what we have to educate the community about the palliative care program that we offer. You can also visit getpalliativecare.org or the Center to Advance Palliative Care, CAPC.org, and there's a wealth of information there. And I just say, just remember that each organization will have its own definition of palliative care. So it's important to do some research about exactly what is offered and exactly what you're looking for. Or you can call us at 973-888-9100 and talk to our intake specialist. Remember, there's never any obligation or pressure to call and learn, a little bit more about our services and how we can help. you would like a workshop at your health facility, library, church, or organization, we're more than happy to come and talk to your constituents about palliative care, hospice, our navigators program.
Wonderful. And Lee, will you please share with the listeners your service area, so that if any of our listeners either live in the area or know someone in the area, they could definitely pass your information along.
Sure. Right now in the Quinlan Palliative Care services New Jersey. So it's Sussex and Warren counties are primarily where the program is launched for Quinlan Palliative Care. We're working on getting in Pennsylvania, so stay tuned. The program will branch out to that area soon.
And the hospice, though, of course, covers more counties
Right.
and areas. Okay.
Right. The hospice were Sussex County, Warren County, and Pike County, PA.
Awesome. Awesome. Um, how can families get involved um, to support the mission of Karen Ann Quinlan?
Well, that's so important. As a nonprofit organization, we really rely heavily on the support of our community, who's been so generous with us since the hospice opened in 1980. So any support that you can offer, either by attending our events, we have paper shreds, we have high tea for hospice, we have golf outings, we have wine and cheese festivals. The 52 weeks in the year, we have 26 special fundraising events. So either, getting involved that way and attending our events, or, making a donation. You can go to karenandquinlanhospice.org/donation to make a donation to our organization. And your donation goes to help support the projects and services at Karen and Quinlan Hospice, and it is greatly appreciated, so that we can continue the work that we're doing in the community.
And it's such important work that y'all are doing, and you'll do a fabulous job. Lee, is there anything that you'd like to share with our listeners? Any importance of palliative care, any impacts or anything that you would like to share with our listeners before we conclude our conversation today?
I'm just going to say, reach out and give us a call to learn more about palliative care, because, as I said, how many people out there suffering with a serious illness that this extra layer of support can help make a difference in your life and the life of your families. Palliative care needs to be available in settings outside of hospitals. It needs to be in medical offices and clinics, and post-acute and long-term facilities, and in patients' homes. And we can help doctors, and we can help patients, and helping to improve patient care, is our main objective. So if you have a question, just reach out and ask us. We are approachable, and we're here for you, and we're here to serve.
And you sure are, and y'all are doing an amazing job. And again, if you'd like to make a donation to help in their amazing work that they're doing, we have the Karen and Quinlan Hospice, Joseph T. Quinlan Bereavement Center. And we also have the Palliative and the Doula Navigators. And if there's anything that you want to know more about, please go visit their website. Lee, thank you so much for joining in with me today. I appreciate it.
Oh, you're welcome. It's great talking to you, Anna. And you are doing a great job, and we really appreciate the movement that you have started here. It's so important. Thank you.
Thank you. And I'm glad to be working amongst amazing individuals out there, that all these professionals that y'all have. Everybody's amazing. So thank you so much. All right,
Right.
everyone. Thank you.